This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, May 19th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. U.S. President Donald Trump is threatening to permanently cut funding to the World Health Organization unless it commits to major improvements within the next 30 days. In a letter to WHO Director General Tedros Adhanom Ghebreyesus, Trump, among his criticisms, says the agency has shown an alarming lack of independence from China during the ongoing coronavirus pandemic. Trump also says the WHO made repeated claims about the virus that were, quote, grossly inaccurate or misleading, and the agency did not properly pressure China for timely admission of international experts, but it did praise China's internal travel restrictions while being against the president's decision to ban entry to travelers from China. But Tedros has defended the WHO, saying it sounded the alarm early and often notifying countries, issuing guidance for health workers within 10 days, and declaring a global health emergency, its highest level of alert on January 30th. Tedros says at that time there were less than 100 cases and 0 deaths outside China. Trump says the U.S. pays the WHO $450 million a year compared to China's $38 million. Now to Africa, where South Sudanese Vice President Riek Machar and his wife Angelina Teny, the defense minister, have both contracted COVID-19, according to Machar's office. His office also revealed that several members of his staff and bodyguards have also tested positive for the coronavirus. Machar says he will now self-quarantine for 14 days. South Sudan has recorded 347 cases of coronavirus and 6 deaths. In Nigeria, the chief of the coronavirus task force says the country is imposing specific lockdown measures in areas that report rapid increases in cases of COVID-19, and it's slowing the phased reopening of the economy. Boss Mustafa says Nigeria is not yet ready for a full reopening of the economy, and tough decisions have to be taken for the good of the greater majority. Senegal's controversial decision to reopen mosques as the Muslim-majority country still battles the coronavirus pandemic is dividing the religious community. Senegal has about 2,500 confirmed infections and at least 25 deaths from COVID-19. While some Muslims have welcomed being able to pray at the mosque during the last week of the holy month of Ramadan, others worry it's too soon and the decision may put worshippers at greater risk of infection. Esther Janjo reports from Dakar.
Senegal's allowing mosques to reopen for the final week of Ramadan was welcomed by thousands of worshippers at the Massalikul Jinan mosque for Friday prayers. But while requirements for social distancing and sanitary measures remain in place during the pandemic, not all the Senegal's Muslims are keen to return to group prayer.
Many people are afraid of this disease. They are afraid to come or to, I don't know, but they are scared because at that hour the mosque is full. Now we are coming back step by step. Those who are not afraid will come. Those who are afraid will stay at home.
Many Muslims, like 26-year-old programmer Philippe Baye, prefer to continue praying at home to reduce the risk of contracting and spreading COVID-19. For him, group worship for Ramadan and until the coronavirus is under control will remain online.
It is a way that makes it possible to spend Ramadan safely. It also brings a dose of spirituality. By being alone, it is true that it is a bit complicated and that people experience difficult things. Spiritually speaking, it's a time that allows us to refocus on ourselves.
Many imams chose not to reopen mosques out of concern for controlling crowds.
We prefer to be careful so that by Ramadan we will see how it evolves and what other receivers tell us. If we are told there's a decline, that the dynamic is not on the rise, we could satisfy this religious demand of a few believers to resume prayers.
Senegal's minority Catholic churches have also chosen to keep their doors closed. Meanwhile, all believers, whether at home or the mosque, are praying for a swift end to the coronavirus pandemic. Esther Githui-Ewart for VOA News, Dakar.
The United Nations Development Programme, in partnership with Jumia Uganda, a leading e-commerce company, have launched an online platform to empower the informal sector, market vendors, small and medium enterprises by connecting them with potential buyers as part of the measures to curtail further transmission of the coronavirus. For more insight, Africa 54's Paul Ndiho spoke to Ron Kawamara, CEO of Jumia Uganda.
Ron Kawamara, welcome to Africa 54.
Good, thank you for having me.
The company that you run, Jumia Uganda, just signed up a partnership with UNDP, or the United Nations Development Program. What is this program about?
We have partnered with UNDP to provide the informal market vendors in Uganda a platform to be able to sell their products to customers who can no longer access the markets, who are now staying home and staying safe. As you know very well, Uganda has been greatly affected by the impact of COVID-19, like many other countries. Many shops have closed, people have lost their livelihoods, but very few sectors have been affected as much as the informal sector. And these sectors are typically dominated by young people, people with disabilities, women. And so this platform provides them an opportunity to continue to sell to their customers who can now not access them in those markets. Jumia has developed a platform together with the UNDP. We're providing training for these vendors, how to price the products, how to package the products. We're offering our last mile logistics and warehousing to be able to hold these items and ship them to the end customer. This is a great opportunity for people who are struggling right now, and we hope that we can test it in these 5 markets and scale this to other markets and the rest of the country in Uganda.
How are you able to do this because you're looking at a sector that is technologically maybe disconnected? Most of these people that you're talking about are off the grid, or they don't even have access to the internet. How are you able to do that?
These vendors are very savvy. They have survived in a very competitive landscape in the markets where they're competing with thousands of other people, whereby they are pricing their products to customers who very well know the pricing, who know the haggling. And these are very savvy customers who just need opportunity and access to technology, and they will pick it up quickly and they will sell.
How did this initiative come about?
Jumia is the leading e-commerce platform in Africa. In Uganda alone, we work with more than 3,000 sellers who are selling to hundreds of thousands of customers in the country. And so we've been doing this for a long time. We've been connecting the seller and the buyer for a long time. And the UNDP has been interested in helping the informal markets for a long time and has been doing it. COVID-19 made it urgent, made it that we have to do it and do it quickly. And it was a natural collaboration between 2 players who have good experience. We have the experience in technology and helping vendors grow and reach customers. UNDP has the expertise and the interest in helping the informal sector continue to thrive in such tough environments. So we're pleased when the UNDP agreed and reached out to us, and we aligned on doing this as a partnership.
How has Jumia Uganda adapted during this COVID? What new things have you put in place to make sure that your business stays afloat?
Our goal from the beginning was always to make sure that our employees are protected. Our goal was to make sure that we put in place all the precautions to protect our teams, to protect our vendors, and to protect our customers. And the second point was to make sure that we can adapt to the changing needs of the consumer. Obviously, in these times, consumers, governments, organizations were looking at safety. We made sure that we secured enough stock for sanitizer, face masks, and things that people needed in their homes to stay safe. We managed to convince our vendors, and we locked them in. So there's no price gouging happening on Jumia, that the pricing did not change much because customers were desperate. We made sure that we provided a safe way to deliver these items to our customers. So we instituted things like cashless and no contact delivery. Essentially, we do not get in touch with the product. We do not get in touch with the customer. But from the moment an order comes in, we're able to package it in a safe way with gloves and face masks. Our drivers are equipped to handle this and deliver this to your doorstep without getting in touch with that product and without you getting in touch with that driver.
On that note, thank you so much, Ron Kawamara.
Thank you.
That was Africa 54's Pondiho speaking to Ron Kawamara, CEO of Jumia in Kampala, Uganda. Uganda banned the use of public and private transport in late March to curb the spread of COVID-19. With a ban on cars, the country has seen a boom in demand for bicycles. Halima Thumani reports from Kampala.
While Uganda workers are worried about losing their jobs due to the coronavirus pandemic, business is booming for bicycle repairman Chiemba Musiri. Uganda's March lockdown to curb the virus included a ban on motor vehicles, both public and private, for non-essential personnel. Musiri says that made the demand for bicycles and bicycle repairs skyrocket.
I've really benefited off the lockdown because generator and lawn mowing machine owners have not been coming. But I've got more people asking for bicycles. I had lots of bicycle stock and I've sold them all. It's been very profitable. I've achieved so much these weeks that I only hope to do in the future.
Bicycle dealer James Chirembeka agrees the transport ban has boosted business, but he says the high demand and economic impact from the coronavirus have also raised costs for bicycles and spare parts.
Also, most people are broke. They no longer have money, because you'll buy a bicycle like this one at $93 or $106, you sell it to a customer at $132, yet he wants to buy it at $66.
Uganda earlier this month eased the lockdown by allowing skilled laborers such as factory workers, mechanics and builders back to work. But commuting by bicycle is a challenge for many, like painter Ziwa Ramadan, who has to cycle 18 kilometers to get to work.
The president said that we must stop by 5 p.m. and you find yourself by 5 p.m. you're still at work and you have to ride a long way from Makinde up to Chitintale or Bugolobi, something that is very, very disturbing. So sometimes you just have to lift it up or you just have to walk, pushing it for you to pass by the roadblocks.
While there are still concerns about COVID-19, many Ugandans are looking forward to the day when public transportation resumes and they can get a lift back to work. Halima Athmani for VA News, Kampala.
Jos, Nigeria-based reporter Ifyoke Tang welcomed the birth of a new child amidst the coronavirus pandemic, but not without anxiety. Let's take a listen.
My wife Nambam and I didn't plan to have a child in the midst of a global pandemic, but we didn't have a choice. The first case of COVID-19 in Nigeria was confirmed in February, when my wife was already 7 months pregnant. Nambam went into labor 3 weeks early. We rushed to the hospital and were grateful to see few patients in the waiting room. On April 18th, we welcomed Deborah Emewabasi into the world. In Nigeria, a grandmother usually comes to stay with the new parents to help with the baby and the mother's healing after the birth. But with the COVID-19 travel restrictions and both our mothers in the high-risk age range, we have to handle things on our own, including entertaining our 3-year-old son. Despite increasing number of infections, Nigerian authorities on May 4th eased a weeks-long lockdown in major cities, but not in Jos. So I continue to work from home as much as possible to keep my growing family healthy. Ifyok Etang for VOA News, Jos, Nigeria.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a recent research finding that could help improve lives for those with Down syndrome. We'll be right back after this break. Welcome back to Africa 54. A surge of deaths in Yemen is prompting aid groups to warn that the war-torn, impoverished nation may have far more than 122 COVID-19 cases reported as of May 17th. Aid groups say hospitals are closing because health workers have no protective gear and people are dying because they cannot get treatment. VOA's Heather Murdoch reports from Istanbul with Nassar Shakar in Sana'a, Yemen.
Yemen's capital appears normal, as if the coronavirus pandemic has almost passed it by. But authorities say there are likely far more cases of COVID-19 in Yemen than is known.
If we take the case of Yemen, there's a very worrying situation emerging in terms of the number of cases in both the north and the south.
Yemen is already suffering from war, famine, and widespread diseases like cholera. But aid workers say hundreds of recent deaths in Yemen were likely undiagnosed COVID-19 patients. Still, here in the north, locals say very few people are wearing masks or practicing social distancing.
Nothing has changed. People come and go as normal without fear of coronavirus. Many people don't even know what coronavirus is. We are a religious country. We only fear God.
The official number of cases has more than doubled in the past 5 days, with most cases reported by the internationally recognized Southern government in Aden. Aid workers say most hospitals in the south have closed because health workers don't have masks or other protective gear, and people are dying while trying to find treatments. The southern government accuses the government that controls the north, known commonly as the Houthis, of underreporting. Yemen's northern and southern governments have been at war since 2014, both backed by powerful international allies. The United Nations calls the suffering the war has wrought on the people of Yemen the world's worst humanitarian crisis. Heather Murdoch reporting for VOA from Istanbul with Nassar Shakar in Sana'a, Yemen.
The COVID-19 pandemic is forcing many into changing their way of life and routines. Muslim communities in the United States who are observing the holy month of Ramadan must too adapt to the new norm as well. Ariadne Budianto narrates this report by VOA's Yunis Salem.
You're inside Ar-Rahmah Mosque. Every evening around 7 to 7:30 p.m., we distribute food. Recipients picked it up in their cars. The mosque youths distributed the packets. For older recipients who are unable to come and pick up the food in person, we will deliver to their homes with our van.
During this Muslim holy month of Ramadan, Ar-Rahmah Mosque in Redmond, Washington, distributes 150 food packages to the community, according to its imam, Indonesian-born Muhammad Joban. The mosque was established in 2006 by the Muslim Association of Puget Sound, the largest Muslim community in the state of Washington. Every Ramadan, Ar-Rahmah hosts iftar meals eaten by Muslims after sunset. They normally serve 300 people during weekdays and up to 1,000 people on weekends. Using drive-through methods, mosques across the nation continue to hold iftars and food distributions, even as they close their doors for communal prayers and activities. Take Dar al-Hijrah Islamic Center in Falls Church, Virginia. The mosque serves as a donation hub for those who want to help and fulfill their religious obligations. The money received, mostly through online donations, is used to purchase the distributed food.
And obviously, Ramadan is the month where Muslims are much more generous than the other months. And because not only that there are many, many rewards for giving charity in Ramadan, but also that was how the Prophet, peace be upon him, used to do.
Before the pandemic, Dar al-Hijrah Mosque served Ramadan iftars to approximately 800 people on weekdays and up to 1,500 people on weekends. This year, they're serving 300 to 600 people with their drive-through program, which is administered with social distancing rules. There are also separate charity funds to help the needy during Ramadan to pay rent and utilities, since millions of people, including Muslims, are out of work. For Unisalim in Falls Church, Virginia, I'm Ariadna Budianto, VOA.
The coronavirus pandemic is putting the lives of students on hold, especially high school graduates who are unable to celebrate the completion of their secondary education with a traditional senior dance, prom, and graduation ceremony. To save the day, award-winning photographer Matt Mendelsohn volunteered to photograph each one of the 500 seniors of Yorktown High School in Arlington, Virginia. Each portrait encapsulates the graduates' talents, hopes, and aspirations. VOA's Penelope Pulu has more.
Just kind of lean on that typewriter top like that. Yeah, like it's more comfortable. There you go.
Award-winning photographer Matt Mendelsohn turns his lens on the graduates of Yorktown High School in his neighborhood in Arlington, Virginia.
I just had this idea that I would boost their spirits a little by going around and taking pictures, creating a photo essay of this sort of forgotten class of 2020, and we called it Not Forgotten, the Yorktown seniors of 2020.
Their school year, like those elsewhere in the country, was cut short due to the pandemic. So were their plans on celebrating graduation. Mendelsohn says what started as a chronicle of loss for each of these 500 students soon morphed into a tribute to their hopes and dreams.
I ask each senior what they're about, what they love. So each senior is photographed differently based on what they're passionate about, what they love to do.
For Grayson, it's books, poetry, and educating others.
I'm going to be a dual degree for elementary education and early childhood education. So I'll be able to teach from kindergarten all the way to 6th grade. And I'd love to have a book published one day.
Jonathan Saldana wants to be an astronomer.
Actually, it was our unit on lenses and focal points that made me want to build my telescope, and why I wanted to put it in my picture, because I feel it's a big part of who I am.
Here we go.
Galilee dreams going into medicine. She was devastated when she heard the school was closing early and graduation ceremony was canceled.
I feel like my memories were kind of robbed from me, so this would be like a good memory that I could show my kids and would be like forever ingrained in my mind.
Rowan, an aspiring history and philosophy student, finds Mendelsohn's Not Forgotten project more intimate than the traditional high school graduation.
I love the idea behind the shoot, like a personal sense of validation or accomplishment, as opposed to just being another person out of 500.
Yorktown High School seniors are anything but forgotten. Mendelsohn's shoot has gone viral the world over.
I'm getting emails from people from Sydney, Australia, saying, "Good luck to the seniors of Yorktown High School. We're thinking about you." From Sydney, Australia. It's just a project that was meant to boost the spirits of this senior class, who, like a lot of other senior classes around America, they're all the same. They're all very smart, they're all very passionate, and they all had a chunk of their senior year just evaporate. So it started out to be a boost, and it's gone crazy.
Penelope Pulu, VOA News, Washington.
The genetic mutation that causes Down syndrome increases the risk of intellectual disabilities in an early death from autoimmune diseases and pneumonia. But it also protects from some cancers, and it often leads to people valued for their kindness and joy. Researchers recently discovered a major clue as to why the genetic disorder does these things. The mutation increases inflammation. Shelley Schledner explains how this knowledge may lead to healthier lives for those with Down syndrome.
You see Megan and I together, we're up to something.
At the Linda Cernick Institute for Down Syndrome in Colorado, researcher Kate Waugh counts the many ways she adores her husband's brother, who has Down syndrome.
He always wants to marry my sisters. He really likes to color. He loves to sing. He brings a lot of joy.
People with Down syndrome have a lower risk for some cancers. As for why, Cernick Institute research shows that they have hyperactive immune systems.
Their immune cells are like Superman cells in some ways. They're revved up, ready to go like gangbusters compared to you and I.
But supercharged can also mean super out of balance, leading to disorders such as alopecia areata, a form of hair loss, and a stressed immune system can get exhausted. That's risky in seasons of flu or COVID-19.
People with Down syndrome already are really predisposed to having severe pneumonia. My brother-in-law, who's in his mid-30s, that's actually the scariest part of the year.
These scientists want to reduce those risks.
The mission of the Cernick Institute is to improve the lives of all people with Down syndrome through biomedical research.
Institute Director Joaquin Espinosa has many buddies with Down syndrome. They include TV star Megan Baumgars from the Emmy-winning series Born This Way about Down syndrome.
He's running the show because he's a star right here.
Oh, sorry. I mean, the person who won an Emmy is not me.
I think it could be
multiple Emmys.
It could be you.
Baumgar's autoimmune disorders include celiac disease. It's no problem when she avoids foods that contain gluten, like wheat. That's not always easy.
My teacher told me I had a bad behavior problem because I had their school food, and they're not gluten-free food. So that's why my mom came back and told my teachers, I don't have a behavior problem. It's the school food that gets me sick.
For you to know that you had celiac disease, it changed your life. It had all kinds of benefits. So we need to come up with quick, effective ways of diagnosing these conditions that are more common in people with Down syndrome.
Espinosa's teams are also investigating how lifestyle and drugs might rebalance the immune system.
People with Down syndrome are up here, and typical people are down here. Bring people with Down syndrome closer to the normal range.
What they discover may help anyone with afflictions that range from cancer and dementia to pneumonia. For VOA News, Shelley Schlender, Denver, Colorado.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.